So the first muscle of the hip that we're going to do is the rectus femoris. Starts at the AIS in the group above the acetabulum and goes all the way down through the patellar tendon to the proximal border of the patella via the proximal border of the tibia via the patella tendon. And for the MMT, we're going to have the patient short sit. So again, and you can put your hand underneath their thigh, bring their leg all the way out, and then resist me for 5 seconds. Ready? 1, 2, 3, 4, 5. We'll do it bilaterally. Again, hand underneath, bring the leg out. All right, resist me for 5 seconds. Ready? 1, 2, 3, 4, 5. All right, relax. All right, so the next muscle we have is the sartorius. That starts at the ASIS and goes down across the thigh and connects into the pes anserine. For the manual muscle test, the patient is supine, and you basically want to have them look at their shoe. So you bring their thigh up, rotate in, and basically you're going to push them down into extension. And yeah. All right, so resist me for 5 seconds. Ready? 1, 2, 3, 4, 5. Do it bilaterally. All right, so bring your leg up. Over. All right, then ready? 1, 2, 3, 4, 5. All right, relax. All right, the next muscle we're going to do is combined muscle. We're going to do the psoas major and the iliacus, which make up the iliopsoas muscle. The psoas major begins on the transverse process of T12 through L5 and inserts into the lesser trochanter of the femur. And the iliacus begins on the iliac crest and inserts into the lesser trochanter of the femur. To test the iliopsoas, you have the patient flex their hip, abduct, and rotate out. And then brace on the opposite side. All right, I'm gonna push you, don't let me break you. All right, ready? 1, 2, 3, 4, 5. All right, relax. And you do that bilaterally. So bring them up, abduct, and rotate out. All right, I'm gonna push you, don't let me break you. Ready? 1, 2, 3, 4, 5. All right, relax. All right, so the next group we have is a hamstring group, which is made up of the bicep femoris, the semitendinosus, and semimembranous, and they all begin at the ischiotuberosity, and the bicep femoris goes down into the lateral fibular head and the lateral condyle of the tibia, and the semis, which also start at the ischiotuberosity, go down, and the semitendinosus connects into the pes anserine, and the semimembranosus connects into the posterior aspect of the medial tibial condyle. So to manual muscle test these, to test the biceps femoris, you would have the patient bring their leg up and rotate them in. All right, I'm gonna pull you back down into knee extension. Don't let me break you. 1, 2, 3, 4, 5. All right, relax. Do it bilaterally. Bring them up and in. All right, ready? 1, 2, 3, 4, 5. All right, relax. And to do the semis, you bring them up and rotate them internally. Now bring them. No, I said the semis. All right. So same thing. Don't let me break you. Ready? 1, 2, 3, 4, 5. All right. And bilaterally. Rotate. All right. Don't let me break you. Ready? 1, 2, 3, 4, 5. All right. So the next muscle we're doing is gluteus maximus, which begins at the posterior sacrum and goes all the way down to gluteotuberosity. So to manual muscle test this, you have the patient flex their knee and extend their hip, and then stabilize, and then you push down. All right, I'm gonna push. Don't let me break you. Ready? 1, 2, 3, 4, 5. Relax. And do bilaterally. All right. So knee flex, extend, stabilize. All right. Ready? Don't let me break you. 1, 2, 3, 4, 5. All right. Relax. All right. So next muscle we're doing is the gluteus medius, and that begins on the iliac crest and goes down to the greater trochanter, the lateral part of the greater trochanter. And to do that, you have the patient sideline, so can you flip towards me, please? So you bring their hip up, internally rotate, and then slight hip extension, and abduction, and then you stabilize. All right, ready? I'm gonna push down, please. Don't let me break you. All right, ready? 1, 2, 3, 4, 5. All right, and you do it bilaterally. Ready? 1, 2, 3, 4, 5. All right, relax. Alright, the gluteus minimus begins at the posterior ilium and goes in the greater trochanter of the femur. Alright, so to test that, you have the patient sideline. So you'd have them just simply raise up in a neutral position, stabilize. Alright, don't let me break you. Ready? 1, 2, 3, 4, 5. Alright. Do it bilaterally. Ready? 1, 2, 3, 4, 5. Alright, so the next muscle is pectineus, and it begins in the anterior pubis and goes down to the pectineal line of the femur. Alright. So the adductor longus begins in the pubic symphysis and goes into the linea aspera. The adductor brevis begins in the pubic ramus and goes down into the linea aspera. And then the gracilis begins in the pubic symphysis and goes down to the pes anserine. So it goes all the way down here. The hip adductor manual muscle test is the patient sideline, so can you please go over on your side. Alright. And then you're going to have them cross their leg over top, and then bring this leg up, and then you're going to brace. Alright, don't let me break you. Ready? 1, 2, 3, 4, 5. Alright, and then you're going to do it bilaterally, so go to the other side, please. Alright, cross your leg. Alright, bring this one up. Alright, ready? 1, 2, 3, 4, 5. Alright, yeah. Alright, so the tensor fasciae latae begins on the iliac crest and the AS-IS and goes down, connects into the ITB band and into Gerdy's tubercle. To do the MMT for this test, you have the patient hip flex, abduct, and then medially rotate, and then you brace. Alright, don't let me push you down. Don't push you normal. Ready? 1, 2, 3, 4, 5. Alright, and then bilaterally. Alright, ready? Ready? Don't let me push you. Alright, ready? 1,